Hello, this is Dr. James Marion, Director of Education and Outreach here at the Susan and Leonard Feinstein Inflammatory Bowel Disease Center at Mount Sinai Medical Center in New York City, welcoming you to another third Thursday recorded broadcast. And today I have a return guest who I have been seeing quite regularly all during our COVID pandemic. And before that, an incredibly crucial and important member of our faculty here, Dr. Lori Kiefer, who's a professor of medicine and psychiatry, uh, and is the only person I can call a gastropsychologist and mean it. Uh, and welcome, Lori. It's so good to have you back with us again.
Thank you. Excited to be doing this.
You help my patients so much, and I'm really excited to have you here, not just as a colleague with all the great work you've been doing on resilience, but to talk about a new initiative. Dr. Kiefer is the co-founder with Dr. Marla Dubinsky here at Mount Sinai as well of the Trellis Health Initiative. And this is a new approach. It is a commercialized approach, frankly, to try to work all that we've learned with your hard work and extraordinary efforts and insight on how to incorporate notions such as resilience into regular practice so that a broader swath of patients might benefit. I think I've got that right. Is that correct, Dr.
That's
Kiefer?
exactly right. Yeah, we want to sort of be able to provide services like we do at the Sinai IBD Center out to people wherever they might be, right? To really democratize IBD care.
That is great. Before we start, brief disclosure, Dr. Dubinsky and Dr. Kiefer are equity owners in Trellis Health, which is a for-profit company. Dr. Dubinsky is the CEO and on the board of directors of this initiative. So just wanted to make sure we're all transparent and on the up and up. So, Dr. Kiefer, I have been really, and my patients have really benefited from the GRIT program here at Mount Sinai. And grit is, as you'd imagine, right, it's an issue of trying to bring notions of uh, resilience, um, empowering patients to employ some of the cognitive behavioral techniques that you've introduced to all of us here at the center. And it's been, I mean, the benefits have been incredible. How is Trellis different?
Yeah, I think that's a great question. I mean, I think that, Trellis, so basically, we've been since 2016, we've run the GRIT program at Sinai, gaining resilience through transitions. And the idea for that program has always been based in a strengths-based approach, positive psychology approach, meaning where can we help our patients become resilient so that no matter what transitions they face across their journey with IBD, they have the tools and skills to learn new strategies as they need them, right? And so what we're really trying to do with Trellis is to really before patients go on to develop co-occurring mental health conditions, problematic self-management behaviors, sort of what we see at the complexity at Mount Sinai, we're really trying to equip our members at Trellis with the same set of tools. So we took that methodology from Sinai and were able to license it to Trellis to further scale and commercialize it. So there's still a human touch at Trellis. There's dietitians, wellness coaches, nurse navigators, but we're using technology to be able to increase access, particularly for patients who need that support in between their office visits. Most patients are really, only seeing their doctor a couple times a year. There's a lot of self-management that has to happen in between that time frame. So we're really there to provide that digital wraparound, not to separate out patients from their GI providers, but to just sort of pop in and give them those services. And so that's where it's a little bit different because we're leveraging the technology and we're not doing as much one-on-one care.
Got it. So then, well, that's the key word, care. So
Mm-hmm.
Trellis, what I'm hearing here, and you correct me, is Trellis providing IBD care?
Right. So that is another big difference. So here at the Sinai IBD Center, right, we're providing care. We're licensed professionals. We're out there one-on-one working with the patient's gastroenterologist in the office.
Hmm.
But at Trellis, we don't want to disintermediate the patient's relationship with their trusted providers, right? People have been diagnosed by these doctors that they love. They don't want to go somewhere else for their care. So what we do, instead of providing care, we're really just sort of helping our members and communicate with their beloved GI provider. So we're just sort of facilitating that communication, and we're also taking the provider's recommendations and making sure that our members know what those are, and removing any kind of barriers to reach them. So, for example, if a provider says, "I really need my patient to go and get a CT scan," but the member says, "I don't want to do it because I'm afraid of the impact of the contrast," we're able to kind of work on that skill to make sure that the self-management occurs before they go back to see their provider.
Yeah, I mean, it sounds like, in a way, what we do here, yeah, we're all a team here and we're all providing care. But one of the things that I've really just loved the most about the way we have it set up here at the IBD Center, and I'm thrilled that this model can now be sort of translated and distributed, and as you said, democratized, because
Mhm.
somebody shouldn't have to travel to New York City
Right.
to see me or one of our IBDologists to enjoy the benefits of this approach, which we've really seen great results with.
Yeah.
When you
Yeah, and
think
actually
about, yeah.
that's a remind we do provide a lot of. I've been talking a lot about the behavioral support, but also, for community doctors, patients being seen in the community, maybe by non-IBD specialists, we also empower our members to really keep track of vaccinations, tight control, therapeutic drug, making sure that all those sort of quality metrics that we're able to do with the infrastructure at Sinai can still go out to people who are being seen, but in other practices.
Right. So when you think about a patient, and I think you sort of started to answer my next question, but I want to close the loop on it. When you think about the ideal Trellis Health IBD patient, give me a sense of what type of patient you think would most likely benefit from this model.
Yeah, I think there's a couple different buckets, if you will. One is sort of our symptom management programming at Trellis. So these are sort of, people who are maybe they're even told that their disease is in remission, but they're still struggling with things like fatigue or bowel urgency or insomnia. Maybe they're having trouble maintaining weight or
Mhm.
finding, solutions to eat. So that's sort of the one bucket of how, can we help people manage symptoms in between visits?
Mm. Wow.
The second bucket is really people who are maybe struggling with either health literacy, they don't understand their disease as well as they're concerned about medications that they're taking, and they just kind of want to know more about that. Maybe they need help learning how to swallow pills or self inject or any of those sort of disease management behaviors. And then the third bucket is that sort of emotional, sort of what we think of as our precursors to problems that develop in the setting of IBD. So people who maybe have trouble accepting their disease, people who have trouble finding support from others around their disease, being able to kind of learn some of those self-regulatory strategies. So kind of those three sort of buckets, I think, are the most common reasons why a member might benefit from Trellis.
Interesting. And I know in rounds and in our discussions, I know you have a term for a particular variety of patients. You call them resilience fives.
Yes.
And I love that term. Would you unwrap that term for our audience? Because I think it's very useful, uh,
Mhm.
and I think it captures a lot of what it seems Trellis is trying to do here.
Yeah, absolutely. So, so resilience in general is just that ability to bounce back from adversity, right? And certainly getting a diagnosis of an IBD is adversity. So, what we really want to do is, my research over the last 25 years, research of other people, has really kind of shown that there's 5 things that sort of predict who's going to be able to manage their condition no matter what comes their way. And that's what we call our Resilience 5. So to become a Resilience 5 patient or a Resilience 5 warrior, we really kind of focus on those 5 strengths. So the first is disease acceptance. The second is maintaining optimism and hope, even when things don't look good. Being able to self regulate, persist, even when things are hard, being able to tolerate distress and emotion and uncomfortable conversations. The being able to maintain social support and ask for help from other people. And then finally, that self confidence in one's ability to do what literally needs to be done, what skills they need. And if people feel that they have those 5 things, then whatever we ask them to do as patients, whatever happens to them as they transition through life, they go off to college, they have a surgery, they get pregnant,
Right.
they'll adjust, they'll adapt, because they have that within them. And that's what we really kind of, we want every patient to have Resilience 5. We know the journey can be hard, but with Resilience 5, you're able to kind of manage.
Well, I think every human being on the planet ought to aim for those life practices, especially these days. Um, so let me say I have a patient. I have a patient here at the IBD Center, or I have a patient out in the community. How do I get them into this program?
Right. So we are open for business. We have a direct to consumer offering. So members basically, right now, we're offering sort of a free, no obligation assessment with one of our resilience navigators. Actually, Rhonda Samaha, who used to be an
Oh,
NP
great.
here, is
Yeah.
one of them. So, basically, you can send your patient to Trellis, right? Patients at trellis.org. And they will answer a series of questions. They will be able to set up an appointment with their navigator and share some of their journey and learn about whether Trellis is right for them. At which point, then they can decide to opt in, and then they get the full bells and whistles of their personalized roadmap, nutrition support, nurse education support, all that good stuff. All
So
for
this, yeah,
$49 a month.
$49 a month. Wow, that sounds great. And what we'll do is include that link with
Yes.
this broadcast as
Yes.
well for any patients or physicians for that matter who are interested, so they can share it with their patients.
Yes, that would be great.
Wow. Well,
Yeah.
listen, Lori, what a journey, right? So it's been wonderful having you here, not just as a guest on the third Thursday broadcast, but just such an important team member here at the Feinstein IBD Center at Mount Sinai. Really very grateful to have you as a colleague here.
Yeah,
So
thank you.
thank you.
Yeah, thanks for having me and getting me to talk about my passion of resilience-based IBD care, right?
You are always welcome now that we're back in business.
Yes,
So
for sure.
so really, thank you very much.
My
So this
pleasure.
is Dr. James Marion at the Susan and Leonard Feinstein Inflammatory Bowel Disease Center at Mount Sinai Medical Center in New York City. Thanking you once again for tuning in to our third Thursday broadcast. See you next month.